call upon Dr. Fairooz, the Manjandavida, for her talk on oculoplasty, minimalistic approach to ocular oncology.
Very good morning to all of you. Thank you to Dr. Rani, especially for curating an amazing IC, which is very different from the rest, and for the KSOS Scientific Committee for having me here today. It's a pleasure to be in Kerala, and I will be talking about minimalistic approach to ocular oncology. Cancer is an endemic disease worldwide. And well, how we have visualized cancer in the past has completely changed in the present. And that is what I'm going to talk to you today. And these are my affiliations and my disclosure. So targeted therapy is something that we have been talking a lot. So since we have identified cellular, molecular, and genetic approaches and signals in different pathologies in human body and cancerous cells in the body, so this came to the development of targeted chemotherapy or molecular therapy, where you identify these molecules at the cellular level, target them, and selectively kill them. And this is called a magic bullet. This is a precision medicine in oncology that we are following at this current point. Now, cancer therapy has evolved. We have seen, to start with, surgical excision alone, then chemotherapy. Well, chemotherapy is currently also considered to have an excellent outcome, but what it lacks is the selectivity. Selectivity of the tumor cells, selectivity of the organ, and also causing systemic toxicity. So as I said, identification of these molecular targets, we have been able to target this particular cancer in a very different way. So earlier we used to talk about pathology, then came an era of immunohistochemistry, and now in future and currently it's going to be completely molecular pathology, where you identify the molecular level and the cellular mechanisms of the tumor, you identify the markers as well as the genetic markers and go ahead. So the first targeted therapy was identified in breast cancer. And where are we in ocular oncology? We have various molecules which has already been identified in uveal melanoma, retinoblastoma, not in practice, conjunctival SCC, we use it a lot, BCC, conjunctival melanoma, and orbital lymphoma. So the pathways in targeted therapies in eyelid BCC is something which came and introduced to ocular oncology initially. Now, the question is, are these FDA approved? Yes, few are FDA approved. Now, are these available in India? Yes, we do have availability in India, and the only disadvantage and the pitfall is the cost, that the financial burden that the patient has to bear. So we have cetuximab, we have erlotinib, we have BRAF inhibitors, we have rituximab. Well, in uveal melanoma, still these targeted therapies available only in United States of America. I'll take you through a few cases. So this was a patient, very classical, of a conjunctival lymphoma with a salmon-colored appearance. So what I went ahead doing was, I decided not to radiate her. I went ahead taking the lesion. It was involving the inferior oblique and the lateral rectus muscle, so it was completely excised. But at microscopic level, I cannot assure that it's completely excised. So what we went ahead was, it was CD20 positive extramarginal B-cell lymphoma. Rituximab is an anti-CD20 receptor drug which targets these lesions. So she underwent local injection of rituximab for whatever the residual was, and she's doing really well after 7 years. CD20 positive, this was my first case, but now it has been very frequently used in my practice as rituximab. This is yet another patient with lymphoma, CD20 positive in the conjunctiva, and this is how we inject. It's a very local injection, totally minimally invasive, and the patient hardly has any side effects post-injection. So this is intralesional injection. This is a lesion involving the entire inferior fornix. So, well, you balloon up the conjunctiva in and around the lesion as well. Now, going on to conjunctival melanoma, what we have is nivolumab. We give 12 cycles of nivolumab and we get good response. So I don't have too much of experience with ipilimumab and relatilimab very difficult to pronounce. Even, certain drugs have been in vogue. So, well, it shows very good response to these drugs. And I hopefully there is availability in India as well. Uveal melanoma is actually a very lethal cancer as far as light salvage is concerned and eye salvage is concerned. And these situations where we find these patients in a very advanced uveal melanoma cases is extraocular extension. This is not rare in India. We often see advanced diseases. So this was a patient who is high risk for systemic metastasis. He did have liver metastasis. We had put him on a PDL2 inhibitor drug, but then he couldn't tolerate the toxicity. He couldn't tolerate the financial burden, and then he had to come out of the treatment, and well, he passed away because of the metastasis. So another thing that I am pursuing my PhD for uveal melanoma, we do have a lot of genetic testing available, but it's not feasible in India because of the cost. Something which can be really done is an immunohistochemistry, which is not expensive. Every uveal melanoma patient, it is good to do a BAP1 immunohistochemistry if you have an enucleated specimen in order to know the prognosis. And this is one of my topic for my research. Well, everything has a downside. The adverse events are also there. It causes a lot of itis, which has to be taken care as well. Now, diffuse ocular surface squamous neoplasia, this eye usually would have been exenterated, which is completely diffuse, including the caruncle. What we do is we go and do the biopsy. This was invasive in the caruncle. Rest was dysplasia. Well, I went and did a conservative approach in this case where cryotherapy was done in the entire lid margin, topical interferon eye drops, and injection of interferon in this lesion. And this was the result. So, well, eyes can be saved. It need not be exenterated. Now, this is venolymphatic malformation. So rituximab is being, bleomycin has been used as venolymphatic malformation, and this is the results that we get. And we have various reports in that, but there are certain situations with venous malformation, we often find it very difficult either to operate or treat it. So what I went ahead doing was injecting bleomycin in even venous malformation. This is also a varix where you can see how clearly it is clinically documented with apoptosis on Valsalva's maneuver. These patients are also treated with injection, and this is a three-way valve mechanism where you aspirate and then you inject. New in radiotherapy, 50 seconds. This is lymphoma again. What we have done is ultra-low dose radiotherapy. Instead of 2400 centigrade, what we use is 200 centigrade day one and 200 centigrade the second day. And there are reports, and this is what I have been doing, already documented 8 cases. That was for the conjunctiva bilateral. This is for the orbit in the right eye, and patients are doing extremely well. So I would say journey of precision medicine and oncology is the way ahead, and it has to be patient-centered, customized, holistic approach. Well, future, we are going to see so many other things like immunonanoformulation. I believe less is more. Thank you, and keep your patients safe. Thank you so much.